Hi, this is Dr. Sherry Shabowski from Medical Education in Minutes. This is another classic clinical presentation, and today we're going to meet Holly Dahl. Meet Holly Dahl, a 48-year-old healthy and active female who recently had a hormonal intrauterine device removed after 5 years. She is a teacher and was lecturing out of town when she developed a severe and sudden, sharp, well localized central chest pain. It was pretty intense, but lasted only a few seconds. She had never felt anything like this before. But it went away, so she didn't think too much of it. 2 days later, the exact same pain reoccurred while she was driving. Again, it went away quickly, but now she was really wondering why she had the same bad pain twice. That evening, she was watching TV and started to feel like a strap was tightening around her chest, squeezing her so tight that she felt like she could not take a breath. This pain would not go away. She wasn't sure what was causing it, but with the two previous pains and now this intense, persistent, unexplained squeezing, she decided to go to the ER. In the ER, they immediately did an EKG and found changes consistent with an anterior wall MI. She couldn't understand it. She had no medical problems, no family history. She did not smoke or use drugs. The doctor told her that her blood test showed a troponin of 35,000, which strongly suggested that the heart attack was causing severe damage. When the cardiologist did an echocardiogram, Holly's left ventricular function was markedly reduced, so she was taken promptly to the cardiac cath lab. The typical cause of a heart attack is a rupture of an atherosclerotic plaque and subsequent clot formation that obstructs the coronary artery, causing the distal tissue to die. It is like a clogged drain that becomes completely obstructed. It is more often seen in older individuals with known risk factors for atherosclerotic or arterial disease. In the cath lab, the doctor identified a surprise. The patient had a coronary artery dissection that resulted in complete obstruction of the left anterior coronary artery. This is the artery that supplies the majority of the left ventricle. Just so we can recall, there are three layers in the arteries. Externally, you have the adventitia. Then there is a thick layer of muscle called the media. And then there is an endothelial lining called the intima. With a spontaneous coronary artery dissection, or SCAD, there is a tear in the intima that allows intraluminal blood to track into the wall of the artery, thereby dissecting the vessel. If there is enough blood in the dissection, it can actually block the flow of blood through the lumen, as seen in the illustration. This causes obstruction to flow and a heart attack. The cardiologist opened up the vessel and reestablished blood flow. Holly's ventricular function began to improve shortly after. Performing percutaneous coronary artery manipulation may be very technically difficult in these cases. The risk is that manipulation could cause worsening of the dissection. Stent placement is also challenging since the vessel is already damaged. A surgical bypass or CABG may be necessary, particularly if the vessel has significant damage. Back to Holly. The cardiologist says, Holly, in the cath lab, we were able to reestablish blood flow to your ventricle, and it is already functioning much better. Your heart attack had a very rare cause. I think this explanation will help you to understand why you had a heart attack when you really have no risk factors. Your heart attack was caused by a spontaneous coronary artery dissection, which is in fact extremely rare. Your arteries have three layers: a thin intimal layer, a thick muscular layer, and an outer adventitia. An arterial dissection is caused by a tear in the inner layer that allows blood from the lumen to track into the muscular wall. This blood within the wall can cause the coronary artery to be blocked from the outside. Yours was completely blocked, and that's why you're having a heart attack. Now, aortic dissections are more common. In the case of an aortic dissection, the pulse pressure built up by isovolumetric contraction of the left ventricle and the explosive release when the pressure exceeds that of the aorta may cause intimal damage that leads to dissection of blood into the arterial wall. This occurs most often in patients with uncontrolled hypertension or those with connective tissue disorders because of the high chronic force or an abnormal vessel. In the case of the coronary arteries, the vessels are backfilled. After the blood explodes into the aorta, the backflow fills the coronary arteries. The pressure in the coronary arteries is the aortic diastolic pressure minus the left ventricular end diastolic pressure, which is significantly lower than aortic pressure. So the mechanism of dissection of the coronary arteries is a little bit less clear. It is a bit of a head scratcher as to what causes the spontaneous coronary artery dissections. But it is known that there are hormonal factors that may predispose women to the SCAD. Estrogen and progesterone fluctuations during pregnancy and postpartum periods, as well as hormonal therapy in the perimenopausal time, can lead to a SCAD, which in your case is likely to be the reason it happened to you. Other possibilities include physical exertion and intense emotional trauma. Certain genetic mutations increase the risk of SCAD as well. Connective tissue disorders, such as fibromuscular dysplasia and Ehlers-Danlos syndrome, may cause increased risk. And atherosclerosis may play a role. Also, to be considered are drugs such as cocaine or amphetamines, which also may increase the risk. In many cases, the cause remains unknown. Those sharp pains you felt may have been the clue, since vascular tears cause abrupt, brief, and severe pain. All in all, it's hard to know what the cause of the heart attack that the cause of a heart attack is a SCAD until we are in the vessel and looking at the occlusion. It is the leading cause of heart attacks in women less than 50 years old, and those women are typically healthy. Your dissection was in the proximal left anterior descending artery that supplies the majority of the left ventricle that is responsible for pumping blood to your whole body. We were able to reestablish the blood flow, but the artery was damaged, and there is a risk that this can happen again. We will start you on medications in an attempt to prevent that, but you will need to return immediately if you have any symptoms reminiscent of this event. Holly was ultimately discharged, but let's check up on her 3 months later. Holly is back to exercising regularly, and she is feeling great. Thanks, doctor. Thank you so much for learning with me. I really appreciate it, and I'll see you next time.